It's Monday, September 20th, 2010. In this week's BeakerBeat, the White House proposes a tax credit that could help the life sciences industry. But will it get past Congress? Plus, another week, another naughty drug maker gets caught and fined. And a sacrificial lamb is offered up to Congress by Johnson & Johnson. All that and more in this week's edition of BeakerBeat.
But we have to do more. And there's currently a jobs bill before Congress that would do two big things for small business owners. Cut more taxes and make available more loans. It would help them get the credit they need and eliminate capital gains taxes on key investments so they have more incentive to invest right now.
Hello everyone, welcome to this week's edition of BeakerBeat. I'm Mike Justice, thanks for tuning in. Well, as you probably know, the big topic across the country is jobs and the lack of them. We've lost thousands in the life sciences biz. But now a new move by the White House could help alleviate that. The current White House administration has not been nearly as supportive of the life sciences industry as others that came before. But now some good news. All categories of the life sciences industry could potentially benefit from President Obama's proposal to expand the R&D tax credit. Obama has asked Congress to expand the tax credit by about 20% and make it permanent. Starting in 1981, the credit has been extended 13 times and expired 8 times, most recently on the final day of 2009. The president sees this as a way to help jumpstart the economy.
But this step will benefit small business owners and our economy right away.
AdvaMed, Bio, and Pharma, plus anyone else in our industry, supports the move by the White House. In a statement by Pharma, quote, "For America to keep its global leadership in medical innovation, it is critical that public policies and programs support continued research and development of new medicines. Investments made in R&D help support the economy and U.S. jobs, including jobs in the U.S.-based biopharmaceutical sector." At the end of the day, this is $100 billion on the table over the next 10 years for companies that are performing research and development in the U.S. A full approval by Congress may take into next year. Yet in the wake of healthcare reform and stem cell rulings, this is the first good news our industry has seen from the Obama White House in a while. So tell us what you think about this story or any story that you see in today's show. It's very simple. Click on the orange button below me. A box will pop up. You type in your comment, you send it to me. I promise I'll read and respond to every one of them. And when you're done watching BeakerBeat, check out Beaker's blog, where we explore an exotic land filled with jungles and beaches and medical devices. Find out where all the big boys are setting up shop. Plus, the world's largest biotech company is looking to grow. We analyze who could be gobbled up by Amgen. All that and more on Beaker's blog. Forest Labs is the latest drug maker to pay through the nose for being naughty. The company agreed to a $313 million settlement with the Department of Justice for selling an unapproved drug, marketing another drug off-label, and lying to FDA inspectors during a visit. Well, at least they were trying pretty hard. The company's Forest Pharma unit pleaded guilty to criminal charges of marketing its unapproved thyroid drug Levothroid and ignoring the agency's warnings to stop. There was misbranding of its antidepressant drug Celexa and claims that Forest sales reps paid doctors to persuade them to prescribe Celexa and its successor Lexapro, giving them cash, quote, disguised as grants or consulting fees, plus expensive meals and entertainment like Broadway tickets, a deep-sea fishing trip, and pro baseball tickets. This comes just 2 weeks after the $600 million Allergan settlement for mismarketing its wrinkle drug Botox. And not to be forgotten, similar settlements. They include Pfizer's $2.3 billion related to Bextra and other drugs, Eli Lilly's $1.4 billion Zyprexa settlement, and AstraZeneca's $520 million Seroquel penalty.
Hello, Edward.
Ron, I've got to fire you.
Well, I've got to fire you. Bing, bong, bong.
You're fired, Ed.
Well, we all figured it was bound to happen with enough pressure and scrutiny. Finally, some heads are beginning to roll at Johnson & Johnson. The company's first sacrificial lamb is none other than Colleen Goggins, its longtime head of consumer products. Her retirement was announced just hours after a U.S. congressional panel disclosed new information about J&J's recent recalls of Tylenol and other consumer meds. The U.S. House Committee on Oversight and Government Reform, citing extremely troubling information, said it would hold another hearing September 30th on the company's repeated recalls. The panel has reason to believe J&J may have considered a second phantom recall, this one for children's Tylenol, almost a year before its formal recall of millions of bottles of that painkiller. Goggins, you may recall, appeared at the May hearing, filling in for an ailing CEO Bill Weldon, and faced an angry committee alone. Weldon will attend the upcoming hearing. So Goggins will retire effective March 1st. Stay tuned for any more retirements if this gets any worse. 2 weeks ago, we told you about the New England Journal of Medicine calling for Abbott Labs' obesity drug Meridia to be pulled from the market. Well, an FDA advisory panel has weighed in on the drug safety, and it's a split vote. The FDA's hand-picked experts voted 8-6-2 on Meridia, 8 for withdrawal, 6 for restricted sales and a black box warning, and 2 for the warning plus close monitoring of patients. So just as with the Avandia panel vote, which saw a similar split, the FDA has no straightforward advice to go on. The agency will have to weigh the panel's findings with its own data, along with Abbott's various ideas for risk management. But even as FDA panelists were split over what restrictions to recommend, most agreed there was limited evidence to support the benefits of Meridia, which was approved back in 1997. The Meridia decision won't break the bank for Abbott. The drug is expected to bring in only $100 million in global sales this year, with less than $30 million sourced in the U.S. But this decision could be an indicator of the FDA's attitude toward weight loss drugs in general, not to mention overall drug safety. Case in point, the agency decided against Arena Pharma's obesity drug lorcaserin, apparently due to safety concerns and a lack of efficacy. This feels similar to the results for Vivus's Cunexa drug a few months ago. I'm sensing a trend here. Time for quick hits now, and with all the old soap operas being canceled, we need to find some new dramas to watch. Fortunately, we here in the life sciences biz have Elon. The power struggle on Elon's board has ended, and existing management won. 2 vocal directors who'd been calling for a new probe of the Irish drug company's management have instead resigned. They are leaving just a short time after being added to the board at the insistence of unhappy shareholders. An independent report on the company's governance centered on several deals involving companies with ties to Elon officials, such as Johnson & Johnson. The investigation found that management didn't do anything wrong and didn't break any laws. The 2 now former directors wanted their own review, but Elon blocked that effort in court, and CEO Kelly Martin issued a letter to shareholders defending himself and the company. Now the 2 directors say they accept the first report and its recommendations for changes, including a new conflicts of interest policy and new public reporting requirements. Whew, these guys need their own reality show. Genzyme is picking up the hiring pace. Its plans call for the hiring of up to 600 manufacturing and quality control workers in Massachusetts through the end of 2011. The news follows a Boston Herald report from last week that the biopharma giant will cut 1,000 jobs worldwide. As one analyst put it, it's all to show that Genzyme is executing on a 5-point plan created to resolve a long list of manufacturing problems and calm activist shareholders. Meanwhile, the company agreed to divest its Genzyme Genetics unit to LabCorp for $925 million in cash. LabCorp has agreed to offer jobs to the unit's 1,900 workers after the deal closes. The FDA has extended the time to complete its review of AstraZeneca's application for Brilinta. The new date is now December 16th, 3 months later than planned. Back in June, the potential blockbuster blood thinner won a landslide 7-1 FDA advisory panel vote. Sometimes being big is a disadvantage. In a new report from the Tufts Center for the Study of Drug Development, the top 10 pharma companies out of the world's top 50 have lower estimated overall clinical approval success rates than do smaller firms in that group. However, the top drug makers appeared to have some R&D productivity advantages. They tended to end their trials of unsuccessful candidates during the early stages of testing, moving on to more promising candidates more quickly. The U.S. Court of Appeals has temporarily stayed a cutoff in government funding for human embryonic stem cell research. As a result, the Obama administration can fund embryonic stem cell studies while it appeals a decision banning government support for such research. The Justice Department has been arguing against Judge Royce Lambert's decision last month that President Barack Obama's executive order expanding government support for the field violated an earlier presidential ban on funding. New warnings for 3 imaging drugs. The FDA is requiring Bayer, Covidien, and GE Healthcare to change the labels of their gadolinium-based contrast agents. They want to highlight the risk of a potentially fatal skin condition when the drugs are given to kidney patients. Checking money matters now, and Johnson & Johnson is not letting its manufacturing woes slow it down. A year after buying a big chunk of Dutch biotech Crucell, J&J wants more, offering $2.3 billion to buy out the company and absorb its vaccine and drug development programs. For shareholders, the offer represents a 58% premium. The 2 companies were partnered on developing several new drugs, including a universal flu shot. A U.S. court has ruled that Danish drugmaker Lundbeck's acquisition of heart defect drug Neoprofen did not reduce market competition. This move has given the company's shares a big boost. Eli Lilly, following a series of setbacks in the clinic, plans to add $150 million to 3 new biotech venture capital funds. The pharma giant expects to cover about 20% of each of the new funds, with each fund reaching $250 million in cash. Lilly's strategy is to back a total of 60 experimental medications, expecting about 15 to 20 will make their way to demonstrating clinical proof of concept. A reminder, we're only a few weeks away from AdvaMed 2010, the MedTech Conference, and Beaker will be there. This October, life sciences CEOs and executives from around the world will gather in Washington, D.C. for AdvaMed 2010, the MedTech Conference. Unlike traditional industry conventions, this conference brings together top industry insiders with a wide range of meaningful subjects up for discussion. From regulatory affairs and reimbursement to IP and business development, if it's important to the industry, you will find it here. Guests will include Dr. Margaret Hamburg and CBS News anchor Katie Couric, along with hundreds of industry leaders. Beaker's an official media partner, and we invite you to join us there. Click on the link on our homepage. It'll tell you how to register and give you all the information you need to know about AdvaMed 2010, the MedTech Conference. Well, that's it for this week's edition of BeakerBeat. I'm Mike Justice. Thanks for watching. We'll see you next week. Sit, Beaker. Sit. Good dog.
Can you guys still hear us?